Haemophilus influenza, right? Let's break this down. Haemophilus means blood loving, right? Right. So, like for the sake of like this explanation which I want to give right now, let's just take Haemophilus, the first part of the name, referring to what? Culture, right? So, Haemophilus, I said it means blood loving, right? So, this organism requires a blood containing medium for growth. The first thing they need is hematine. Hematine found in blood is necessary for the bacterium's cytochrome system. Blood also contains NAD positive, right? So this NAD positive is needed for metabolic activity, right? So that's all about the Haemophilus part. What about influenza? Right. So this bacteria often attacks the lungs of persons debilitated by a viral influenza infection. Okay. During the 1890 and 1918 influenza pandemics, scientists cultured Haemophilus influenza from the upper respiratory tracts of flu patients, leading them to incorrectly conclude that Haemophilus influenza was the etiologic agent of the flu, right? So flu is caused by what? Influenza viruses, orthomix of viruses, right? So we covered those. If you want to compare these two, you can click the link on the top right corner and watch the influenza virus, right? So let's continue. Haemophilus influenza is an obligate human parasite, right? Only humans are affected. That is transmitted via the respiratory route. Right. So there are two main ways this bacteria cause diseases, right? So the first way is because of this polysaccharide capsule. Polysaccharide capsule composed of polyribitol ribose phosphate can confer virulence to the bacteria, right? So there are about 6 types of capsules designated A through F. Right. So of these, only type B is commonly associated with invasive Haemophilus influenza disease in children, such as meningitis, epiglottitis, and septic arthritis. Right. So a second group of like this bacteria is non-capsulated, right? So non-capsulated strains, also called non-typeable Haemophilus influenza, can colonize the upper respiratory tract of children and adults. Right. So these strains, the non-capsulated strains, they lack the virulent invasiveness of their encapsulated cousins and can only cause local infection. They frequently cause otitis media in children, as well as respiratory diseases in adults weakened by pre-existing lung diseases such as chronic bronchitis from smoking or recent viral influenza infection. Right. So polysaccharide capsule, that's the first way. The second way, let's just say absence of antibodies, right? Why? Because antibodies to the capsule are lacking in infants and in children between 6 months and 3 years of age, right? So this range, the children will be like sitting ducks. They will be like at high risk of getting H flu, right? The mother possesses antibodies against the B capsule, which she has acquired in her lifetime. She passes these antibodies to the fetus transplacentally and in her breast milk. These passively acquired antibodies last for about 6 months, right? So after birth, 6 months, right? It takes about 3 to 5 years of Haemophilus influenza colonization and infection for the children to develop their own antibodies, right? So there is a window during which children are sitting ducks for the invasive Haemophilus influenza, right? So Haemophilus influenza type B causes 4 main diseases, right? Meningitis, acute epiglottitis, septic arthritis, and sepsis. All right, so let's discuss these one by one, right? Starting with meningitis. Meningitis is the most serious infection caused by encapsulated Haemophilus influenza type B. But now, now there is a vaccine for this Haemophilus influenza type B. But prior to the introduction of vaccination of the US children in 1991, it was the main cause of meningitis in young children between the age of 6 months to 3 years, right? So more than 10,000 cases per year were recorded, right? Okay, so this is, we can say this is the pathogenesis. Following inhalation, this organism invades the local lymph nodes and bloodstream and then penetrates into the meninges, causing inflammation of the meninges, right? Thus, meningitis. Since infants usually do not display the classic stiff neck or nuchal rigidity, right? Non-specific signs such as fever, vomiting, altered mental status are the clues to the potentially fatal infection caused by H-flu. Although mortality with appropriate antibiotics is less than 5%, up to a half of infected children will still have permanent residual neurological deficits such as mental retardation, seizures, language delay, or deafness. When bacterial meningitis is treated with antibiotics, the killed bacteria will undergo a process called what? Lysis, right? They lyse and release cellular antigens such as lipopolysaccharide, lipid A, it's an endotoxin, resulting in violent immune response that destroys the neurons as well as the bacteria, right? So this destruction of neurons is the one responsible for the neurological deficits, which I just mentioned. So studies show that treatment with steroids, like for 15 to 20 minutes before giving IV antibiotics, will decrease the risk of developing neurological deficits. It is theorized that the steroids limit the inflammatory response to the dead bacteria's antigens while allowing bacterial killing. Right. Here there is a basic concept. I'm sure I've been giving you this concept throughout the entire bacteriology series. Right. Neonatal meningitis. There are 3 bacteria responsible for most meningitis acquired by the baby coming out of the birth canal, right, within the first 3 months of age. Okay, right. So 3 bacteria within the first 3 months of age, and these 3 bacteria are Listeria monocytogenes, E. coli, and group B Streptococcus, also known as Streptococcus agalactiae, right? So within the first 3 months, you need to look out for these 3, right, in neonatal meningitis. Then 2 bacteria cause meningitis later in life, right? Now it's between 6 months to 3 years after the maternal antibodies passively given to the fetus when and before the new antibodies develop. Right, so this is where you find Neisseria meningitis, and Haemophilus influenza, right? So in conclusion, you can say within the first 3 months, there are 3 bacteria which are usually responsible for neonatal meningitis. They include Listeria monocytogenes, E. coli, and group B streptococcus, right? And then within the period of 6 months to 3 years, like before the new antibodies are formed, it's a window period. It's where the babies are susceptible to Neisseria meningitis and Haemophilus influenza, right? Cool. Okay, right. So that was the first condition, meningitis. The second disease here is acute epiglottitis, right? It's an inflammation of epiglottis. Haemophilus influenza type B can also cause rapid swelling of the epiglottis, obstructing the respiratory tract and esophagus. Following a sore throat and fever, the child develops upper airway wheezing, right, or inspiration. Inspiration is stridor, right, and is unable to swallow, dysphagia, right. Excessive saliva will draw out of child's mouth as it is unable to pass through the swollen epiglottis. Right. So on examination, let's say we use a laryngoscopy, right? We will see the large red epiglottis looking like a red cherry at the base of the tongue, right? I want to show you like how it will look like, right? Okay, so you can see here on the right, right? Okay, that was a wrong slide. Okay, on the right, look here. This is the red cherry epiglottis. This is what it looks like, right? This is an X-ray. So in X-ray, this acute epiglottitis caused by H flu has a specific feature, right? It's known as a thumb sign. It's known as a thumb sign, right? You can see here where the arrow is. It's called a thumb sign, right? There's another sign called a stipple sign. Stipple sign. Stipple sign is usually found in croup. Croup is caused by paramyxovirus. Yeah, paramyxovirus. Again, there's a link on the top right corner. We covered this virus, right? It causes stipple sign. And then thumb sign, H flu, Haemophilus influenza. Right? Okay. So, if you suspect this infection, do not examine the larynx unless you are ready to insert an endotracheal breathing tube, because manipulation can cause laryngeal spasms. This may cause complete airway obstruction that can only be bypassed with tracheostomy. Right, the next disease is septic arthritis. Haemophilus influenza type B is the most common cause of septic arthritis in infants. Most commonly, a single joint is infected, resulting in fever, pain, swelling, and decreased mobility of the joint. Examination of the synovial fluid, right, that's the joint fluid, by Gram stain reveals the pleomorphic gram-negative rods. Pleomorphic gram-negative rods. I just want to remind you something. When we're talking about gonorrhea, if you take this synovial fluid, you won't see any bacteria, right? They will be inside the neutrophils, right? Just to remember that concept. Okay. The last condition is sepsis. This sepsis occurs in children between 3 months to 3 years. I mean, those children who present with fever, lethargy, loss of appetite, and no evidence of localized diseases like otitis media, meningitis, or epiglottitis. The bacteria invade the bloodstream via upper respiratory tracts, right? Since the spleen is the most important organ in fighting off infection by encapsulated bacteria, children with absent or non-functional spleens, either by surgery or with sickle cell disease, are at high risk, right? So, do you remember three important bacteria, three encapsulated bacteria, right, eradicated by the spleen? If you remember the pneumonic sheen, like Streptococcus pneumonia, Neisseria meningitis, and Haemophilus influenza. Is right? Okay. Now let's talk about vaccination, because I told you there is a vaccine for H flu type B, to be more specific, right? So it's known as Hib capsule vaccine, right? Haemophilus influenza type B capsule vaccine. The first vaccine, consisting of purified type B capsule, was effective only in generating antibodies in children older than 18 months. Currently, the used vaccines are composed of H influenza or Haemophilus influenza capsule, polyribitol ribose phosphate or PRP, conjugated with mutant diphtheria toxin protein, a Neisseria meningitis outer membrane protein, or a tetanus toxoid, to activate the T lymphocytes and antibodies against the type B capsule antigens. Okay, let's go through this again, right? So previously, a long back, they were using a vaccine that was like only purified type B capsule, right? But this one was only effective in generating antibodies in children older than 18 months, right? So now they are no longer using this purified one. They are conjugating it with what? Mutant diphtheria toxin protein, Neisseria meningitis outer membrane protein, or tetanus toxoid, right? So this conjugation will help in activating the T lymphocytes and antibodies against the type B capsule antigen, or against the B capsule antigens, to be more specific, right? Okay, so vaccination with the Hib capsule vaccine of children in the United States is done at age 2, that's 2 months, 4 months, 6 months, and 15 months, right? Along with DPT and polio vaccines, right? So this vaccination has drastically reduced the incidence of Haemophilus influenza infection. Another approach involves immunizing women in the 8th month of pregnancy, resulting in increased antibody secretion in breast milk, right? So this is called what? Passive immunization, right? If you're enjoying this video, please make sure you give it thumbs up, right? Okay, so to conclude this video, we are going to have an overview, right? So you need to know this before going to class or before going to an exam, right? You need this information, right? So Haemophilus influenza is a small gram-negative or coccobacillar rod, right? It is an aerosol transmission, or simply respiratory droplets, right? So non-typeable or encapsulated strains are the most common cause of mucosal infections, such as otitis media, conjunctivitis, bronchitis, as well as invasive infections. Since the vaccine for capsular type B, Haemophilus influenza, was introduced, right? So these main conditions are caused by non-typeable H flu, right? This bacteria produces IgA protease, IgA protease. You can culture this bacteria on chocolate agar, which contains factor 5, that's NAD positive, and factor 10, that's hematin, right? So these two, I told you, are needed for growth. What else can you do? You can also grow this bacteria with Staph aureus, because Staph aureus causes hemolysis, right? So this hemolysis of RBCs will produce or provide factor 5. Right. Haemophilus influenza causes epiglottitis, right? So on endoscopy, you see something like this. All right. Okay. It can be a cherry red in children, and you can see a thumb sign in a lateral x-ray. I showed you that image again. It also causes meningitis, otitis media, and pneumonia, right? So you can see there is if you read the word Haemophilus, right? EMOP, right? Just to take the middle part, EMOP for epiglottitis, meningitis, otitis media, and pneumonia, right? And on epiglottitis, just to remember the cherry red, mostly in children, and remember the thumb sign, right? Okay, what about the vaccine? The vaccine contains type B capsular polysaccharides, that's polyribosyl ribitophosphate, conjugated with diphtheria toxoid or other proteins, right? It's usually given between 2 and 18 months of age. It does not cause the flu, right? This bacteria does not cause a flu. Flu is caused by influenza viruses. It's very important. Don't confuse there. Treatment, we usually use amoxicillin. We can use it with clavulinate acid or without it for mucosal infections, right? So this combination for mucosal infections, and we can use ceftriaxone for meningitis and rifampin for prophylaxis for close contacts, right? So if you are at home and then one child has been diagnosed with H flu, right? Close contacts, like those who are staying in the same room but haven't yet shown any signs of this condition or any signs of infection by H flu, we give them rifampin. We also give rifampin in close contacts. You know, Neisseria meningitis. Yeah, it's same antibiotic for prophylaxis, right? Thank you so much, guys. If you like this video, I told you what you have to do. And if you feel like the information we are giving on this channel is helpful, please subscribe. If you get the opportunity to donate, guys, I will really appreciate that, because I'm trying to make high quality videos. Right now you can see my camera is not so perfect. I have a lot of ideas, but I need a good camera, not using my phone like this. Okay, don't let me down. If you check the link in the description box, you will see like a link to my PayPal, and also in the comment section you will see another link leading to my PayPal. Every dollar counts. Until next time, see you guys.